Let's go live to Professor Karen Price, President of the Royal Australian College of GPs. Thanks for your time. What's your reaction to the report today that billions of dollars are being reported from Medicare each year by medical practitioners? That was the report in the 9 newspapers. What's your response?
Well, it is a rather sensational claim, and it's drawn from limited data. I think the word rorting and fraud is rather sensationalist. I think it's a concern if there's any fraud whatsoever, and we certainly don't support any fraud. But I think we've got to ask ourselves whether or not the author of this particular report is suggesting that the government is incompetent at looking after Medicare, because there are 4 levels of compliance within the Department of Health and within the government to make sure that doctors and anyone using Medicare funds are looking after that properly. So there are 4 levels of compliance, and I'm just wondering whether or not if there has been this degree of so-called fraud, $8 billion, if the government's going to ignore that, I would think that's pretty unlikely. I think these are rather outsized claims, and certainly we don't support fraud. But I think there's a bigger issue here, which is Medicare being fragmented into ever smaller bits that do make it very difficult to work with.
Well, you spoke about the initial report. It has been corroborated to the extent that Tony Webber, former head of Medicare watchdog, the Professional Services Review, a GP himself, he says that I've read the report, he said, and I'd have to agree with what she's said, is what Dr. Webber argued. Do you think some leakage in the system is there?
Look, it's limited data that they've worked from, and again, there is a company that Margaret runs that runs a business that supplies work to deal with Medicare billing. So there is some degree of conflict of interest regarding some of this. So I think we're all very concerned about public stewardship of money, but what they're talking about is if someone hasn't ticked a particular box and they're asked to repay money for work done, that's not exactly fraud. That's the difficulties of managing a Medicare system, which is being split into ever smaller pieces, and the patient has still got the care they've received, just that the doctors had to repay it. So, we note that 47% of our doctors in Health of the Nation survey have said they don't claim Medicare item numbers. So if we're going to take a very critical and a proper critical appraisal of Medicare, then we really need to look at those who are undercharging it, as well as those who may be falling short of what we would consider to be professional standards. But I just come back to, again, that Medicare has 4 levels of compliance from the government and the Department of Health, and I'm pretty surprised that there's 2 people suggesting that that layer of compliance is incompetent.
The Australian National Audit Office into Medicare compliance released in November a report suggesting the estimated cost of health provider issues or non-compliance was upwards of $2.2 billion. That in itself, I mean, it's not $8 billion, but it's still a significant number. Would you like to see some sort of overall audit or review done if we're talking about non-compliance to that sort of magnitude of over $2 billion?
Well, of course, it's across the whole medical profession, not only general practice. And one of the statements that was made was that there are dying patients who are being given treatments by the oncologist that may not be appropriate. So that's, again, another big call. I think that we do need to look at Medicare, and we are looking at Medicare. We've just had a summit with all sorts of health economists and PHNs, patient groups, as well as doctors, looking at the Medicare issue. And we've also got a Medicare task force, which is being run with very senior health economists, looking at how Medicare can be better fit for purpose to serve patients' needs around Australia. And that's really what we're focused on. Of course, anyone who's committing something fraudulently needs to be challenged. But for those people where they ring up, ask the Medicare, there's an Ask MBS service, when a doctor can ring up and get 20 different answers, because even the admin of Medicare can't interpret the legislation that sits around those item numbers appropriately. That makes it very difficult for doctors. And all legal processes, of course, are challengeable in court. And, this is a very challenging part of Medicare. And my contention is that Medicare has been split into ever smaller bits that make it very difficult to administer medicine. We know that doctors are spending more time trying to look up the compliance required for Medicare than actually seeing patients. So there is an issue, and we need to look at it. But I think the claim that there's all this fraud going on is a rather sensationalist claim. But certainly, I think the four layers of compliance that are already in the department are working well. We know that, for instance, one person was picked up for inappropriate telehealth on one call. So if they can do that, they can certainly find where this magic number appears to be.
The AMA says that the claims are baseless and that doctors have been thrown under the bus by this report. Would you agree with that assessment?
I think it's sensationally provided 1 week before the budget, and there are conflict of interest issues, and the figures are rather rubbery. So, I think I stand with the AMA on that, and it's a bit sad when the doctors have given so much during COVID and are continuing to give a lot to patients with mental health conditions and chronic health conditions, where we're going to government saying we need to look after our vulnerable patients. This sort of article is raised at this point. I think it's a bit sad.
Professor Karen Price from the College of GPs, thanks.
Thank you.